Hello viewers. Today we have with us Dr. Chirag Bhandari, who's the founder of the Jaipur-based Institute of Andrology and Sexual Health. Dr. Bhandari is one of the youngest men's health coaches in India. A certified andrologist from American Society of Reproductive Medicine, he has done fellowship in andrology from the University College of London Hospital and another fellowship in psychosocial medicine from JSS University, Mysore, India. Welcome, Dr. Bhandari.
Thank you very much. Thank you for having me here. Thank you for the kind words. I'm really glad to be here.
We are happy to have you here, and hopefully, some of the queries of our viewers will be resolved through what you talk today.
Sure, sure. I will be really happy to hear positive feedback about this whole video and also to help people, your audience, who are going to listen to us.
Yeah.
Really.
So, I'll begin in the beginning. So, what's your role as the men's health coach?
So
Like,
basically, yeah, I advise men on, see, as an andrologist, I treat men with, their reproductive problems. But
yeah,
as a coach, I advise them on their lifestyle, on their nutrition, how to live their life, how to, I try to encourage them to live a healthy lifestyle, make certain changes, and have a healthy relationship with their spouses apart from all the you know medical problems, treating medical problems what they have, that
yeah.
is, as a coach, I advise them on living their life to the full.
So that means it involves like you are like of a physician. If you see certain things, then you will.
Yeah, I see. I am a basically a surgeon, so
Uh,
I operate also when required. I mean, in certain cases we have to operate some in some diseases, and I also prescribe medications. I also coach them on their lifestyle, what they should do to have a healthier reproductive life, a healthier intimate life with their partner, and just general advice on living disease free, and how to prevent a few certain diseases which happen in men as they age.
okay. So what percentage of do the men come to on their own, or do you hold
Yeah,
workshops or maybe seminars to guide them? How
I
many
yeah
people
I
come? Like how many people come on their own? Like how many men come on their own to discuss about their health issues?
I
Like if
think
you have
most
to
of
give
the
a
men,
percentage, huh?
I would say most of the men, they come on their own only. They
Acha.
find me on the internet or in the newspapers or in some articles,
Uh-huh.
and then they approach me with their queries. I tell
Uh-huh.
them that it's better we talk face to face. So either they come to my clinic or we do a online video session in which they discuss about their problems, and then I advise them what can be done or prescribe medications, or if the situation is really bad, then I would advise them to come to the clinic so that I can examine them personally. So most of the men, they come on their own.
No, no.
So I
What
do
what
hold.
I
Mhm.
what I meant was, see, people generally, as Indians, we are very careless about our health. We don't pay much
Right,
attention to uh, till the time like it is manifesting into something bigger. We keep it on hold. कि ठीक हो जाएगा अपने आप हो जाएगा करके. So I
right,
am
right,
asking from that angle. Do you have to
right,
like
right.
also like educate men?
Yeah, a lot, a lot. So you know, the sessions like these, I do these sessions quite often.
Hmm.
Then I write a lot of blogs,
Okay.
and I do some podcasts also just to
Okay.
educate men about what can go wrong as they
Hmm.
age, and
Hmm.
what is normal, what is abnormal, what is a myth and what is a fact. So
Yeah.
all these things I tell them, and most of the men, they find it really reassuring, and they find the information very helpful, because they come to know that whether they are actually suffering from a problem or it's just in their head.
Yeah, that's right.
Yeah.
So, what is the age group of men who come to you?
Almost all the age groups
Hmm. Hmm.
above the age of, in fact, children also, parents are
Hmm.
worried about their children, so sometimes they also bring them to me to see
Hmm.
if they are growing well or not, if
Okay.
anything is wrong. And mostly young middle-aged men who are worried about, who are beginning their adulthood, and have recently had a partner or are in a committed relationship and facing some issues. So basically, all age groups. So
So,
I wouldn't say like
uh,
one age group, but all age
okay.
groups. Yeah.
So, men are becoming proactive about their health.
Yeah,
We can
yeah,
say.
they are actually, they are. In fact,
Okay.
even the women, even their partners, they are
Mm-hmm.
quite outspoken these days, and they convince them, that if you have a problem,
Mm-hmm.
why don't you go and meet a doctor?
Yeah.
So most, you see, many of these men, they will be reluctant to go to a doctor, and they will be shy, or they will, have this male ego that I cannot have a problem. So in these cases, their partners, they have a pretty big role in convincing them to meet a doctor. And then later on, even in the treatment, if the partner is cooperative and supportive,
Yeah.
the success rate of treatment also goes up drastically.
Okay, okay. So, are there
Yeah.
any specific health issues? This is not. I'm not like basically talking about the sexual health, but general health. What are the any? Are there any specific health issues which are? Are there any health issues which are specific to men, which to which men are more prone as compared
Well,
to
yeah,
women?
as men age,
Hmm.
there could be deficiency of hormones like testosterone, the prostate, which is a gland present
Hmm.
only in men, that
Hmm.
can increase, and it can cause problems in urination, or the sexual life as well.
Hmm.
Um, and then there are various types of other ailments specific to men, like lower urinary tract symptoms, and a few type of cancers are quite common in men, like the lung cancer, prostate
Okay.
cancer. These are quite common in men. So as they age, yeah, they might face these kind of issues. So I advise them to take preventive health checkups every now and then, and make them aware about, such diseases exist, and such problems can cause, such diseases can cause problems later on in life if not dealt with on time.
Hmm. So, what are the specific lifestyle changes that you advise them?
Well, the most important lifestyle change would be to become more active. Okay, as in like, not only just exercising, or going out for a walk or run, or just being active, as in like doing your household work, moving around in the house, moving around in the workplace, and doing things on your own, not depending on anybody. And apart from, specific time for exercise or yoga, or developing a specific hobby, which will keep there. Because if you have a hobby, if you are doing something in which you are interested, your mind grows, and it relaxes your mind, so because mental health is also a big concern these days. And indulging yourself in a pleasurable activity will release dopamine, and that'll keep you happy. So taking up a hobby or playing a sport of your choice, and that is important. Then in lifestyle, I also advise them about the food they should eat, because food has a very important role in the long run. Obviously, not in the short run, but in the long run, food has a big role. So I advise them to, inculcate a Mediterranean diet, which is
Okay.
full of vegetables and omega 3, 6, 9 fatty acids, and a lot of fruits and vegetables, lot of pulses, good protein, good amount of proteins, good amount of fats. So Mediterranean diet is one thing, and then obviously the usual: reduce smoking or quit smoking, reduce your consumption of alcohol or marijuana. All these things. If you are overweight, try to reduce weight.
Hmm. Okay.
Then, if they have a partner, then how to build a healthy relationship with your partner, like going out frequently, doing something you both like, going out for a date, trying something new, talking about life in general, with when nobody is around, away from the kids and all. So I advise them on all these things so that they can have a healthier physical, mental, and
Emotional.
emotional life. Yeah,
Yeah. So,
exactly.
so in the last so many years since you have been practicing, what sort of changes have you seen? Like when you advise, like you have been, you must be doing all this since the very beginning, these kind of advices and all. So, what sort of changes have you seen in the attitude towards this kind of talk among the men? Are younger
Hmm.
men more receptive to that, or are older men more receptive to that? From say 10 years back, what was the situation and what is the situation now?
Yeah. So yes, there is definitely a more acceptance, more openness about these topics. People are talking about it. Obviously, to not so many people, but yeah, so a good percentage of men have started opening up about their problems. Mostly young men, because they are more tech savvy. They read a lot on internet, and they come up and ask for the problems. Yeah, not with the older men. I would say they are still, not that aware, or not. They are quite closed, because of their attitude or the way they have grown up and seen things around. So, but yeah, more young men are coming to me and they are seeking solutions for their problems.
Okay. Now we'll come to your specific field. What is the status of male infertility in India? And
Well, about 40% of the couples who come to infertility clinics, in those 40% are because of the male infertility.
okay.
Okay, the rest 40% is because of the female infertility, and 20% is basically either both, or no known cause is found in either of the partners. So it is a huge number, and earlier it was quite ignored. Earlier, the females were the one who were treated. The males were never asked to give a sample, but now the things have changed, and with lot of studies coming in, and with all the experiences we have gained so far, we have found that 40% of the cases have male factor infertility. So that is a huge number, and
That's
India
a
is,
huge.
yeah, yeah, and well, I don't know the exact figure of infertile couples, but there hasn't been any study in India to actually know, how much, what is the percentage of infertility. But yes, it's quite a lot, as evident by so many in vitro fertilization clinics all across India. They are booming up everywhere, even in small parts of India. So that in itself tells us that there are a lot of couples who suffer from this problem.
Mm. So, what is the reason for this rising infertility?
Well, I think it would be a lot of reasons. There cannot be one single reason, but I would say it's just the lifestyle. Obviously, you've become less active, you've become less, the food, the dietary changes. The diets have changed. You are eating more of the food from outside and the junk food and all that, and sedentary lifestyle. A lot of stress, actually. I would say stress is a very big factor. Stress about your work, about your life, about your career, about your partner, about children. So, in general, a lot of stress is there. So, no specific reason which we can point out, but it is a combination of a whole lot of reasons linked to the lifestyle.
So maybe also it is also the numbers you see also because earlier men were not coming forward for the tests and all. One reason could be
Yeah,
that also.
yeah. Because earlier people did not know so much about these problems, that they could also have these problems. Now with the
Yeah.
internet and all the social media and all, people are becoming really aware. I mean, the information is reaching to each and every individual in
Yeah.
the remotest corner of the country. So with this information, and more open attitude towards these problems, the people are coming up and seeking solutions.
So what's the status of infertility like globally? What is the status? Is India moving ahead with that scary
I
figure,
think
or
India
it
is,
is an
yeah.
overall thing?
No, I think India is probably in the top 10 countries when it comes to infertility. It is definitely, you know, one of the top countries in the, if you talk about impotency, because owing to the large number of diabetics we have in India, it's the diabetic capital of the world as well. So yeah, so even in infertility, it is among the top 4 5 countries, I would say. So it's quite a big number, owing to the population. Seeing the population, it's quite a big number.
So can you give us some figure? Like you said, 40% of male infertility is there in India. So globally, what is this percentage? Would you?
Yeah, it's the same. Forty
Acha,
percent is the same.
acha.
About 100 couples who come to infertility clinic, 40% will have male factor infertility. That's the same
Globally.
everywhere all around the world.
Oh,
Yeah,
okay,
yeah, yeah,
okay,
yeah,
okay, okay,
yeah.
okay. And now you spoke about this thing a little earlier that men don't talk about they don't accept that they can be a problem with that. So what are the reasons for that? Is it just the male ego or?
I think it's the male ego, and also the way they have been brought up. They've seen things around, and what things have been passed from generations, that nothing can go wrong with a man. Man's most, I mean, the manhood in men is, comes from the sexual aspect of it. So that kind of ideas have been passed down from generations. They've seen in so many videos around, and so many even on the internet, that the men are glorified. The sexual health is glorified. So that is why it comes on their ego, that they cannot accept that uh, something which is so precious to men has gone wrong, and that he may no longer be considered a man if people come to know about these problems.
So how do you
So
counsel them?
the most
So,
important thing in treating these patients is just reassuring them that this is a very common problem, and and then there is a scientific solution for this problem. and just telling them that, in a few days or few weeks time you will be as normal as you were before.
Acha.
Just reassurance and educating them makes a huge difference in
Okay.
treating such men.
Okay. And when we come to diet, are there any specific food items like which
I
are
I
helpful?
am yeah. So there was a study which it showed that Mediterranean diet is good for not only for your heart, your arteries, your mind, and obviously your reproductive health. So Mediterranean diet is the one in which there are a lot of legumes and pulses and vegetables and foods rich in omega fatty acids. You know, so these
So
these
that is
I would, yeah,
that is general health. That is for general health. I'm asking, are
yeah,
there any specific food items that are good
no
for sexual
specific food.
health?
No, no,
You
no.
just
There is
have a
nothing
normal
specific.
healthy diet and exercise and all.
There is nothing. There is nothing. Yeah, yeah, yeah.
That is good enough.
It's not like there is one particular item which you will eat and you will have a very good healthy
Huh.
sexual life. No, it's not like that. It's not like
Okay.
that. Doesn't happen
Because
like that.
because there are things floating on that aspect also. Ki eat this, it'll benefit you, and all those things are
Yeah,
there.
I mean, internet is full of that. There, eat these things, and you will have the problem. You will have
Uh,
the solutions to your problems.
uh,
Dark chocolates and
mm,
raspberries and strawberries and
mm,
pomegranate and
mm,
spinach and all that is okay. They are healthy,
mm,
but just not eating them will
uh,
cure your problem.
yeah,
I mean, if there is a problem, you need something else. You need a medical
yeah,
solution.
true,
Yeah.
true, true. Okay. So, as we come to an end, Dr. Bhandari, I would ask you, would you like to give any message to our viewers, those who are listening to us, would be
The
listening to us?
most important message I would
Uh,
like to give is that do not suffer in silence. If you have a problem, seek out to your doctor and take take a scientific evidence based treatment for your problems. India is full of quacks and all these unauthorized people who are treating such problems. So just be aware of them. Talk openly about the problem with your doctor, and if you live a healthier lifestyle, which means doing exercises and having a good balanced diet and all that, obviously quitting smoking and reducing alcohol, that is going to help you in the long run. But if you have a problem, don't just rely on the lifestyle changes. Seek some help from a doctor who will reassure you and tell you what exactly is wrong and what you can do to correct it.
Okay. Thank you so much, Doctor. And we'll be hopefully back to you for some more answers to some more questions. But till
Thank
then,
you.
yeah, have a great day. Thank you so
Thank you
much.
very much. Thank you for having me.
Yeah,
Thank you. Bye
thank you.
bye. Bye.
Thank you. Bye.